Preparing for a healthy holiday. It's a beautiful summer day as we take this live look over Campus Martius Beach. The bright skies are inspiring some of us to make 4th of July plans, and we want you to stay safe. In today's health alert, summer has brought a fresh wave of COVID-19 infections. Case levels have been rising for weeks due to new variants, leading to increased ER visits and sadly deaths. Thank you for staying with us. I'm Simon Shakett, our chief health editor. Dr. Partha Nandi here with us now to talk about the latest CDC data and where these highest caseloads actually are.
Yeah, we're talking about COVID again, right? So according to CDC's COVID data tracker, emergency room department visits have risen by 23.3%, and deaths have increased by 14.3% in the most recent weeks. Now, data from the sewage tracking system wastewater scan shows that this summer's COVID-19 wave started earlier than last year and now has reached levels similar to last summer's peak. And since the virus is kind of like us, loves warm, humid weather, it's spreading most in the western and southern parts of the U.S. right now. And in fact, viral levels in the West are as high as they were back in February. Now, the increase in cases is likely due to a family of variants descendant from the JN1 variant, nicknamed, believe it or not, FLIRT. This name refers to where these variants changed amino acids. Their mutations help them dodge the body's immune response and helps them spread more easily. According to CDC's data, 2 of these variants, KP3, KP2, now make up more than half of all new COVID-19 infections in the U.S. You like that name, FLIRT, there?
People will remember it. That's the important part.
Exactly right.
We talk about the summertime. When do we peak and what do we know about new vaccinations?
Absolutely. So initially, right, Simon, the FDA approved a plan to update the COVID-19 shots to be more effective against the JN1 lineage, but later advised manufacturers to target the KP2 strain as they gain more ground. Now, the new vaccines are expected to be ready sometime in mid-August. I'll get it when it's ready, to late September. And once available, the CDC recommends that people 6 months and older get the updated COVID-19 vaccine for the 24-25 season. And that's because research shows this, that the vaccine's effectiveness does wane over time, does decrease over time. And even though COVID is always circulating at some level, getting vaccinated in the fall offers the best protection for most folks during the colder months, since we tend to see higher and longer peaks of infections. We've seen that before. As for the summer peak, COVID-19 can still surprise us since it's known to be unpredictable. So we'll have to wait and see if cases continue to rise or level off. And we'll let you know, of course. To lower your chances of getting sick, the CDC and I as well advise staying up to date on vaccinations, washing your hands well, and staying home, please. If you feel sick, wearing a mask is also smart. Although no mask is perfect, studies show this, that high quality masks, Simon, can filter out particles, lower your risk of catching COVID because it reduces how much virus you might breathe in around you. So it's important. This stuff is still important. And, you know, and people say, well, I'm okay, I'm healthy, but what about the elderly person next to you or the immunocompromised person next to you?
And so many of us care for our parents and grandparents too.
100%, 100%.
Doctor, thank you. Thanks
for being here.
My
pleasure, of course.
And if you have a health question for the doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook or on X.